Hi, this is Dr. Joannides, the Chief Medical Director at Optimum Re, and this is the Optimum Academy, Pulmonary 101, video number 8 on interstitial lung disease. So let's get started. So when you look at all of interstitial lung diseases, they fit into, they're a subset of all lung diseases, which include, many other types of lung diseases, but interstitial lung diseases, abbreviated ILD, is a subset of that. And then a subset of interstitial lung diseases are those diseases that have pulmonary fibrosis. So we're going to talk about that today. So what does interstitial mean? And you can see I have spared no expense and drew my own diagram here to give you an idea of what interstitial actually means. And I'm calling it as between layers. So if you look at the left, and we're going to pretend that that bubble-looking thing is an alveolus in the lung, and you breathe in air which has oxygen, and the oxygen goes from the alveolus through that green material, which is the interstitium, into the capillaries, so red blood cells can be filled up with oxygen that attaches to hemoglobin. Also, carbon dioxide comes out from the blood, goes into the alveolus, and is breathed out into the atmosphere. So there's the exchange of oxygen and carbon dioxide, and they both go through that interstitium into the little network of capillaries that surround all the alveoli. Now, if you look at the picture on the right, if that interstitium becomes thickened, in other words, the green material becomes thick, it's more difficult for the oxygen and the carbon dioxide to pass back and forth because there's more layers or more thickness to go through. So you can see how a thick interstitium prevents or can prevent the exchange of gases. So that's the idea I was trying to convey with this slide. So here's a better slide that actually I didn't draw, and it shows again circled in red that in the lungs, when there's a thick interstitium, it's going to be more difficult for the gases to pass back and forth from the alveoli into all the little blood vessels that surround the alveoli. And you can see to the upper right, you can see in that picture how the thickened interstitium plays a role, and it's called damaged alveoli, supply less oxygen to the body. So let's talk about the types of interstitial lung disease. They encompass a group of diverse conditions characterized by inflammation and scarring of the lung. So you have idiopathic pulmonary fibrosis, or IPF, a progressive and often fatal form of fibrosing interstitial lung disease of unknown cause. Then connective tissue diseases can cause interstitial lung disease like rheumatoid arthritis or systemic sclerosis. Hypersensitivity pneumonitis, that's inflammatory lung disease triggered by exposure to environmental antigens. We're going to talk about that. And then sarcoidosis, which is a granulomatous disease affecting multiple organs, including the lungs. We can also lump that into a type of interstitial lung disease as well. So, what's the clinical presentation? It can present with symptoms such as progressive shortness of breath, or dyspnea, cough, dry cough, fatigue, and chest discomfort. The symptoms are often insidious, and diagnosis may be delayed due to their nonspecific nature. High-resolution computed tomography, HRCT, is a key imaging modality for detecting interstitial lung disease patterns in the lungs. Pulmonary function tests, PFTs, help assess lung function, including restrictive patterns common in ILD, and bronchoscopy and lung biopsy may be performed for a definitive diagnosis. So, in interstitial lung disease, Again, it's this inability of the gases to pass back and forth through that interstitium that causes the problem. So there's also a post-COVID interstitial lung disease. The exact etiology of COVID and subsequent pulmonary fibrosis is not yet fully understood, but it can cause what are described as ground glass nodules in the lungs. So there's also an element of interstitial lung disease that can be secondary to COVID infection. Talking about this idiopathic interstitial lung disease, it's diseases characterized by progressive fibrosis and scarring of the lung, which leads to stiffness of the lungs and difficulty breathing. And there's no known cause of this. So here are types of idiopathic interstitial pneumonias, the most common and severe of which is idiopathic pulmonary fibrosis. Other nonspecific types are nonspecific interstitial pneumonia, cryptogenic organizing pneumonia, acute interstitial pneumonia, desquamative interstitial pneumonia, respiratory bronchiolitis associated interstitial lung disease, lymphoid interstitial pneumonia, and idiopathic pleuroparenchymal fibroelastosis. So a lot of big names, and it's difficult to make each of these diagnoses. They're all lumped into interstitial lung disease. So how do you make the diagnosis? Typically, it's a combination of chest x-rays and computed tomography scans to visualize the lung damage. Lung function tests are used to assess breathing capacity. Blood tests rule out other conditions sometimes, and a lung biopsy may be needed, and the lung tissue is looked at under a microscope. So what's the treatment? There's no cure for idiopathic interstitial lung diseases. Treatment focuses on managing symptoms and slowing the disease progression. So medications like corticosteroids or antifibrotic drugs may help reduce the inflammation and slow fibrosis. Oxygen may be given to help with breathing. Pulmonary rehabilitation to improve lung function and quality of life, and in severe cases, even lung transplantation may be considered. Now, speaking of the interstitial lung diseases that are part of connective tissue related diseases, in rheumatoid arthritis, for instance, it can be called rheumatoid lung. So in some cases of rheumatoid arthritis, it can have interstitial lung disease. It may be fibrosis, or you may actually have nodules or pleural disease associated with rheumatoid arthritis. We also mentioned another subset is hypersensitivity pneumonitis, and this is an inflammatory lung condition caused by allergic reaction to inhaled substances or particles. And there's things such as farmer's lung, caused by mold from hay, straw, or grain, bagasosis, which is moldy sugar cane, which can cause hypersensitivity pneumonitis. Bird fancier's lung, also called psittacosis, is triggered by proteins from bird feathers or droppings. It can be from parakeets, canaries, or pigeons. There's humidifier lung caused by fungi and poorly maintained humidifiers or air conditioners. And there's also something called hot tub lung from bacteria and water vapor from indoor hot tubs. So these are just some pictures to give you an idea of what we're talking about here. So pigeon droppings can affect some people, moldy hay, other bird droppings for like parakeets or other birds that are kept inside the house, and then a moldy humidifier. Speaking of bagasosis, it's from sugarcane. Sugarcane is where we get sugar in a lot of parts of the world. In the U.S., it's about 40% of our sugar production. In the rest of the world, it may be even greater. And once you extract the sugar from the sugar cane, you get that bagasse or that pile of brown stuff on the right that the farmer is working with, and that can get moldy, and actually that can cause a hypersensitivity pneumonitis. Hot tub lung is a person can inhale aerosolized non-tuberculous mycobacteria from contaminated hot water. And there's other bacteria that can cause problems, so people may have a hypersensitivity pneumonitis secondary to being around a hot tub. Another group that we talked about was ILD and sarcoidosis. Sarcoidosis is an inflammatory disease that can affect multiple organs, but commonly impacts the lungs, and it can cause a type of fibrosis referred to as pulmonary sarcoidosis or sarcoid lung disease. And the diagnosis is typically made, again, by chest x-rays or CT scans. Pulmonary function tests may be used, and then bronchoscopy to get a biopsy to determine whether the interstitial lung disease is due to sarcoid. There are stages of sarcoidosis. Stage 0 is a normal chest x-ray. Stage 1 has enlarged lymph nodes only. Stage 2 has enlarged lymph nodes and lung infiltrates. Stage 3 has lung infiltrates only. And stage 4 has pulmonary fibrosis, which is permanent scarring. Now, how do you tell the difference between sarcoid and tuberculosis? In TB, if a biopsy is obtained, it shows what's depicted on the left. And if you look at that circular area, it looks kind of cheesy in the middle. The word caseating actually means cheesy. So in TB, you get a cheesy looking granuloma, whereas in sarcoid, the picture to the right, there's no cheesy center to that circular area. So that's the difference in the biopsies when you are trying to determine whether something is TB, tuberculosis, or sarcoidosis. So when we talk about spirometry and interstitial lung disease, the classical pattern is a restrictive ventilatory abnormality. In prior videos, we talked about obstructive lung disease. This is restrictive lung disease. So what's the difference? So this is characterized by a decreased forced vital capacity, or decreased FVC. There still may be a normal or increased FEV1, or forced expiratory volume in 1 second, over FVC ratio, and FEV1 may be preserved. We talked about in obstructive lung disease that FEV1 was decreased. So here you can see in the bottom graph, the volume is on the y-axis, the time is on the x-axis, and you can see that in the blue line, which is normal, there's a rapid increase in blowing out of air in the first second, and it stays basically flat after that. So there's no obstructive lung disease. The air gets out very quickly in the first second. It also gets out very quickly in the red line, but as you'll notice, the total volume that's able to be blown out by the lungs is much reduced. So that's what we call restrictive lung disease. There's no obstruction to the air getting out. There's just less air that's available to get out due to this restrictive ventilatory abnormality. So that's the difference between this, which is restrictive lung disease, and it's just a reduced forced vital capacity, versus obstructive lung disease, which has difficulty exhaling the air in the first second. You may also see on APSs a flow volume loop. And what I like to remember is that a normal flow volume loop looks like the Rock of Gibraltar, which is pictured in the upper left. So if you see a flow volume loop that looks like the Rock of Gibraltar, it's probably normal. But you can see at the bottom, here's what a flow volume loop of restrictive lung disease would look like. Everything is reduced, just like in the graph that we just saw on the prior slide. Things are reduced, the same in the blue line there depicted. When you compare that to normal, it's like everything got shrunk. So that's what happens with a flow volume loop in restrictive lung disease. These are X-ray pictures showing the difference between a normal chest X-ray on the left. You can see the dark areas are the lung tissue, and the strips going across are the ribs, the heart's in the middle. And when we look at a chest X-ray, it's like the person is facing us. So to our left is the right lung, and to our right is the left lung. So when you look at interstitial lung disease X-ray on the right, you can see all that white streaky material in the right lung base. That's all interstitial lung disease. So that's what we would typically see on a chest X-ray with somebody with some type of interstitial lung disease. Again, same type situation. Here are some additional pictures, but this is a post-COVID interstitial lung disease pictured on the right. And you can see these rounded areas that kind of look like somebody ground some glass. At least use your imagination. That's how they're described. And ground glass nodules are often seen in post-COVID interstitial lung disease. So to get these biopsies that I've talked about previously, you need to do that to determine whether the fibrosis is actually interstitial lung disease. A flexible bronchoscope is used as depicted on the left, and you can bend the scope around corners and try to get a biopsy. In the old days, actually a straight biopsy was done using a rigid bronchoscope, which, as you can imagine, is difficult to get into somebody's lung, and nobody asks for a second round of doing that for sure. So here's a case that I wanted to show you, and this is in the attending physician statement. Pardon me. And you can see that I've highlighted in yellow in the notes here. It says that this person has an autoimmune disorder, and they were diagnosed with interstitial lung disease. That's ILD, secondary to connective tissue disorder, was made. And this person is being treated with anti-inflammatory type medications to try to resolve this. So they're being treated with Celsep and hydroxychloroquine in order to help with the fibrosis that's present. And they're probably also been treated with steroids as well. So when somebody has interstitial lung disease, they may require some pretty intensive medications in order to try to resolve the problem. You can see here what spirometry would look like in somebody with interstitial lung disease. If you look at the FVC, which is the third line down, you can see that in the percentage of predicted, it's at 58%. So it's a little more than half. So where those circles are on the graph to the upper right, that was what was predicted for normal, but you can see that this line is much reduced, just as we depicted in a prior slide. Also, if you look at the flow volume loop to the upper left, you can see that that's reduced in size. It certainly doesn't look like the Rock of Gibraltar, right? So this would be a typical finding of restrictive lung disease. And if you look at the very bottom of the slide, it says impression, moderate restrictive spirometry. So this is a typical restrictive lung disease pattern on spirometry. I also wanted to mention the DLCO test. And you may see this on somebody that's possibly thought to have restrictive lung disease. It's the diffusing capacity of the lungs. To do that test, you actually use carbon monoxide in tiny amounts, and don't try this at home. And that test is used to determine how fast gas can pass through that interstitium that we talked about. And the reason carbon monoxide is used, it has the qualities that are useful in determining how fast things can cross the interstitium. And as a general guideline, 80 to 100% is considered normal. So if you see percentages that are less than that, it may be due to interstitial lung disease. So look for the DLCO test. And if you have questions, we can always help you with determining what the results of that test mean. So what are the treatment approaches for interstitial lung disease? Its treatment is aimed to manage symptoms, slow the disease progression, and address underlying causes. Medications may include steroids, antifibrotic agents, and sometimes oxygen therapy and pulmonary rehabilitation may be needed. And then, as we mentioned before, even lung transplantation may be used in some cases. So we have a case number 2, a 55-year-old woman was seen in the emergency room with shortness of breath for 4 to 6 hours after feeding her pigeons. She required nasal oxygen for relief. A CT of the chest showed mild interstitial thickening. Her sedimentation rate, which is a test we use to determine how much inflammation is present. So it's an inflammatory marker. And this is high, normal is 20 or less. Her PFT showed a restrictive pattern, which we just talked about on a slide a few slides ago. She did eventually have a biopsy using a bronchoscope, which revealed chronic hypersensitivity pneumonitis. So she was also tested for antibodies with antigen testing, and it was positive for bird antibodies. And so she was treated with steroids and had marked improvement and was told to avoid birds. So this is an example of hypersensitivity pneumonitis. So what's the prognosis? It varies depending on the type, the severity, and whether it's a particular disease that can respond to treatment. Idiopathic pulmonary fibrosis has a less favorable prognosis since we don't know what causes it, so it's difficult to treat. And often candidates with severe interstitial lung disease are not candidates for life insurance. So that completes our video on interstitial lung disease.